Meantime, we want to get to a health alert that many of you have been talking about online. For the first time ever, Virginia health officials have confirmed a case of dengue fever. It appears to have been transmitted in northern Virginia. Health officials say a local mosquito likely became infected and then transmitted the virus. Joining us now to talk more about what this disease is and how it spreads is Dr. Peter Armbruster, a professor in Georgetown University's Department of Biology. Thank you so much for joining us.
Sure, happy to be here.
In simple terms, you study mosquitoes, right?
That's correct.
So let's start with the basics here to help us understand better what dengue fever is and what the symptoms are.
Sure. So it's a viral pathogen. It's transmitted by a number of different mosquito species, and it causes kind of acute fever, as well as soreness, muscle, and joint aches.
Now, those are some of the lesser severe symptoms. How do you know when it's an urgent time, like you have to seek medical emergency?
Yeah, I think if any of those symptoms were so severe that they were debilitating, you would
Mhm.
want to seek professional medical care. Also, if you've ever previously been infected by dengue and you have reason to believe that you've been exposed to a second infection, then that can be quite serious. That can lead to what's referred to as dengue hemorrhagic fever, which can be fatal.
And doctor, we know in this case, this person did not travel outside of the state, according to health officials. So as far as how it spreads, it's believed that a local mosquito first bit the infected traveler and then later bit this person in Northern Virginia, passing along the virus. Is this the most common way it's transmitted?
Yeah, absolutely. And, this kind of incident is rare, but it's happened in Florida, and it's also happened in parts of Europe. So it's not unprecedented by any means.
Okay, along those lines, I mean, how significant is it that Virginia has now documented its first locally acquired case?
Yeah, I think it's a notable public health event that requires attention. It sounds like local public health authorities are undertaking some surveillance efforts, which is totally appropriate. But it's not a sign of an impending outbreak. It's likely, a one-off event that hopefully will end with just that single infection.
Okay, so the risk to the public is low. I know that's what health officials are urging as well. What are some practical things, though, that we can do to reduce the risk?
So the first is to try and eliminate any mosquito habitat around the area where you live. So any containers that might hold standing water, things like flower pots or the kind of little trays that people often put under their flower pots. Um, Old refuse that's been left out that might accumulate water. The mosquitoes can use that as breeding habitat. And also rain gutters, if they're not cleaned thoroughly on a regular basis, can provide a habitat for the mosquitoes. So getting rid of potential habitat anywhere around your house, and then trying to avoid exposure to biting mosquitoes by covering yourself up and wearing mosquito repellent.
Doctor, before we let you go in 15 seconds or less, what's the big takeaway, the big message to anyone who's really worried about this?
Do everything you can to reduce your exposure to mosquitoes,
All right.
biting mosquitoes.
Dr. Peter Armbruster, a professor in Georgetown University's Department of Biology. We certainly appreciate your insight and knowledge on this. Thank you so much.
All right. Thank you.
All right, take care.